Cataracts can happen to anyone regardless of age, but like gray hair, they may be a normal part of the aging process. Last year in the state of Florida alone, there were over 109,000 Medicare, Medicaid cataract surgeries performed. Joining us to discuss cataract surgery and other eye care questions are leading experts from our area here in Southwest Florida. They are Dr. David Brown, founder and medical director of the Eye Center of Florida in Fort Myers; Dr. Charles Montgomery, medical director and owner of the Montgomery Eye Center in Naples; and Dr. Joseph Spadafora, partner in the Community Eye Center of Charlotte County. Gentlemen, thank you all for coming together to join us. In talking about the Medicare, Medicaid numbers of procedures, I suppose one question that a lot of viewers might have is over the insurance issue and the time that that takes and so forth. Dr. Brown, what's involved in getting approval for a procedure in that process?
Very little is involved for the patient's standpoint. Cataract surgery is the most common operation performed in the United States, and so the procedures for development of the insurance are worked out very finely. Patients present to the office with the appropriate insurance information, such as their Medicare card or a private health insurance carrier, and the doctor's office does the basic paperwork for them. Approval is easily obtained. Some patients' insurance companies need to have a second opinion prior to surgery, but our office can make arrangements for the second opinion to be done. And we also have a new system in which the government has imposed a review requiring a 72-hour period in which Medicare reviews the patient's findings regarding their vision, need for surgery, and so forth, and then grants approval. This is a rather arbitrary rule and does not have anything to do with a person's access to health care.
How much coverage does Medicare provide in the case of a cataract surgery procedure?
It will vary depending on the surgeon's fee, but in general, Medicare will cover approximately 80% of the surgeon's fee and almost all of the facility fees associated, such as the hospital or outpatient surgery facility.
Okay. To kind of start at the beginning, how do I know when I have cataracts? What clues come to me that tell me that I'm beginning to have this problem?
I think most people feel that their vision has changed and deteriorated in some way. Perhaps they may notice that their distance vision is not as sharp as they once had it, or perhaps their reading vision may not be as sharp. And oftentimes they think, well, gee, maybe all I need is a change of my glasses, and they seek an examination to find out if a glass. Of course, they're all hoping that a glasses change will restore their vision to what it had been.
Do you think in any case that they're afraid to come to you because they think they may have cataracts and that they may be in for surgery and that they postpone that at all?
People's personalities are as diverse as from A to Z, and some people will have a greater fear than others. It's really an unnecessary fear. Cataract surgery has been improved so much in the recent years that it's so much easier for a person to go through it now that there's really no need for them to fear it. It's not a painful experience, and there's really very few restrictions in the period of time after the surgery. So we certainly hope that people won't be afraid of it. I think almost everyone has a neighbor who's had cataract surgery, and all they have to do is talk to their neighbor and find out how much easier it was to have gone through it than when their mother or grandmother went through it.
Yeah. Assuming that it is a cataract problem, how do you determine when that surgery ought to be performed?
It really depends on the individual again, because most people can do most of their functions of everyday life, but sometimes they have a difficulty. Say they were a cab driver and they had a difficulty seeing. Or in our community, in Port Charlotte, when people work in the grocery store and they can't see their sidewalk and they find themselves tripping on things, maybe that's their difficulty. They're noticing some other problems. So they come on into the office and they get evaluation. They find, oh yes, I do have a cataract. Well, is it significant? Are both eyes involved or is it just one eye? And these questions have to be worked out with the individual and what their entire lifestyle is. If a person stays at home and simply reads and has no need for distance vision, no need to be able to see all the fine details of their world, they have no difficulties, they don't need surgery. But if a person finds they can't do the things they want to do, can't do the things they need to do, they make the decision for themselves. We're simply there providing services for the individual. And they'll tell us it's time for surgery or not.
I see. In the technique that we just saw that they called, I think, phacoemulsification or something, do each of you perform a similar procedure to that? Is that level of care available here in Southwest Florida?
Phacoemulsification is basically the level of care for modern-day cataract surgery. The operation was first developed in 1973, and with refinements in instrumentation and different surgical techniques associated with phacoemulsification, it has evolved into the standard of care. The advantages of phacoemulsification are that it enables the operation to be done with a very high degree of predictability, a very high degree of success, and most important from a person's point of view, enables the patient to get up and virtually leave the operating room and pick up normal activity. And I've never seen anything in medicine change so much as cataract surgery has changed for us, and it has just made a world of difference for our patients.
In this kind of a procedure, how quickly can I go swim, play golf, do any of those kinds of things?
As fast as you can leave the operating room and drive home.
That's incredible. Are there other kinds of surgery that are indicated in some cases from the kind that we've just seen? Are there other techniques for doing cataract operations apart from this one?
There may be, and it again will depend on the equipment that the surgeon has at his disposal and his level of training and skill and experience. In my instance, I seldom resort to other methods of taking the cataract out because phacoemulsification is a very safe procedure, and coupled with caution and judgment, most any cataract can be treated with phacoemulsification.
There are no other circumstances of the cataract itself that force you into a different kind of a procedure, huh?
There may be. The cataract can be dislocated. The cataract can be so hard that it's like a little piece of stone that doesn't allow itself to be broken up with the ultrasound, but in most instances it can be removed with the ultrasonic technique.
How do you feel about rubella cataracts or the homocystinuria? Or do you do the phacoemulsification?
Again, I certainly would, because I feel the advantages of the phacoemulsification technique overweigh some of the feared complications that you might encounter with a complicated case. And certainly one can change a course in mid-surgery if necessary. Simply because we intend to do the procedure with phacoemulsification does not mean that you cannot convert to another technique to remove the cataract. So I approach each patient optimistically. I want the advantage of the small incision, and therefore I'm going to make a decision to the patient's benefit if it's necessary to convert.
You mentioned before that the pain factor, is it different for different people, and what can a person expect following the surgery?
As a rule, most cases of cataract surgery are done under local anesthetic. Relatively few are done under general anesthetic. There are certain indications where one will do that. For example, if you had a child or if you had an adult who was unable to cooperate for some reason, perhaps they were mentally incapable of holding still, for example, then one might do general anesthetic. But a very large number of people that have cataracts also have many other medical diseases, and certainly a local anesthetic is much safer in an elderly person with multiple diseases of other natures. The techniques for anesthetic, like so many other of the things that we're talking about in medicine, have evolved and improved tremendously to the point now where people don't even remember the anesthetic, because lots of times they'll be given a mild sedative which makes them drowsy. Then when they get the anesthetic injection, they don't even realize that it's happened. Years ago, before we had that technology, the people would complain more about the anesthetic than anything else about the operation. But fortunately, I think those days are pretty much behind us.
In most of the cases after the procedure, we're talking about an aspirin or a Tylenol or something like that to deal with.
I would say at least half my patients don't even take an aspirin or a Tylenol. I suspect that's probably average, don't you think?
I agree. There's really, in an uncomplicated patient's operation, no need. There's no pain. There's perhaps most people will notice a bit of scratching at the incision site, but not anything more than that. And this clears up in a few days.
Yeah. Following the surgery, the kind of vision that they have changes a bit for a period of time. I've heard that they get some blurring. How much of that, and is there anything that's typical as to what a patient experiences?
I think it's each physician's style, basically, and as they get into their technique and further down the line, they can find changes. I myself find 40% of the people the first after surgery see 20, 40 or better, and then with every passing day, they see much, much better. And that's a major change from just 3 or 4 years ago when people were having a much more difficult time regaining their vision.
Would their vision progress, and then might they have some days where it would slip back, or is it a steady progression?
In the old days, the older techniques, people did have, for the first 2 weeks, fluctuations of vision almost every other day. But nowadays, with the phaco emulsification, I find people to be more stable sooner. I start refracting for glasses at 5 days, and I usually give it 2 to 3 weeks with the newer techniques, whereas in the old days, it had to be 6, 8, sometimes 3 months before they were allowed to get their final prescription.
Yeah. And so their new glasses are coming
anywhere from 14 to 21 days after the surgery.
I see. In this kind of a procedure, there must at sometimes be complications that people have, and are there any that are more normal than others, that if you're going to get complications, are there particular kinds that you get?
I think every surgeon fears complications probably as much or more than his patients do. As cataract surgery has improved over the years, the complication rate has gone down. Those of us who do phacoemulsification and are basically obsessive-compulsive people, ophthalmologists are obsessive-compulsive, and when our patients have complications, we get upset. We worry about that as much as our patients do. But to answer your question directly, yes, there are certain things that are more common. For example, retinal detachment is a complication that occurs maybe in 1 out of 100 people. And the worst part of it is, from the surgeon's standpoint, is we can't do anything to prevent that. Try as we will, we have not been able to get past that problem. It's somehow related to the surgery, and it happens despite our best efforts to prevent it. That's probably the complication that we run into, that we worry about the most. And occasionally people will get some swelling in the retina. Again, not because of anything that we do or the patient does, but something triggers it associated with the surgery. Again, that's less than 1 in 100. If you look at the overall complication rate, with modern cataract surgery, it should be less than 3%, perhaps even less than that. And even taking all the patients that we do, including those people that really don't have as good an outlook because they may have some other problem associated with the eye, better than 19 out of 20 should see well enough to pass the driver's license test. Now, of course, no matter how well one does the surgery, if they have another type of problem, a deterioration in the back of the eye, for example, no matter how well we do that surgery, that person isn't going to see better than the limiting value of whatever problem it is in the back of the eye.
So a person should not have a fear of the possibility of blindness in going into this kind of surgery. I mean, that is so rare or never happens?
Certainly it happens, but that's an unrealistic expectation, because we've been talking about the improvements in the way that we remove the cataract, and These techniques that we have developed lessen the number of complications. Things that were common complications 20 years ago seldom happen today because we've changed our technique. At the same time that we were working to improve our technique with cataract surgery, the retina surgeon, for instance, that Dr. Montgomery mentioned, was also improving his technique in terms of how do I repair this retinal detachment and get this patient's vision back so that he's not disabled or visually impaired because of this complication. There are new medications, less complications for metastatic, for instance, as Dr. Montgomery mentioned. There's new medications for the treatment of swollen retina, which can interfere with visions. And so, of course, we have to be realistic and say complications can arise in any activity in life, but we have better means of preventing them and better means of treating them when they do occur. So there's no reason to expect the worst.
Are there things that people can do to prevent getting cataracts? Is there self-eye care that will retard that, keep that from happening at all? Are there any do's and don'ts that will keep them from getting to that stage?
I think the only thing that one can do really is our general health measures. There have been some studies that have suggested that perhaps one component of sunlight may be a problem, the ultraviolet. So one can prevent that by being a major problem by having an ultraviolet filter put in the glasses. You can even put it in a pair of clear glasses as well as sunglasses. The general things of eating a balanced diet and that sort of thing may or may not have any influence. There's really no evidence that that really makes any difference. There are relatively few things that one can do to prevent cataracts. If we could all find the fountain of youth and keep from getting older, then that would probably be the single biggest thing, but I guess that's not really very realistic.
Is it likely down the road in medical research that we find ways to prevent cataracts from developing? I mean, is that at all a possibility of the future?
There was a study out by Johns Hopkins which suggested that the people who get the fastest cataract formation are those who are in the water a lot because they have direct sunlight and the light off the water. That's one thing we have in Florida, abundance of water, so we have that excessive exposure if you're a waterman. The other part of that, there's a doctor who's doing research on the other coast of Florida who has a drop which is ultraviolet absorbing eye drop. But again, it's not been approved by the FDA yet and is still in the clinical trials. But there are things out there that we're all trying to think about something to do to try to prevent these things from forming. I mean, think of an eye drop, which is a pair of sunglasses, that's ideal. But then we're certain somebody's going to have a reaction to that.
That's right.
So.
That's right.
If we were as successful as the dentists have been in preventing tooth decay and practically putting themselves out of business, if we could find a way to prevent cataracts, that would be the most wonderful thing we could happen, because none of the four of us would have them that way, as well as the rest of our patients.
Given the luxury of having you with us tonight, let me ask, apart from cataracts, some things about general eye care and some comments that you might want to make. I was noticing the other day a number of people reacting to burning eyes and so forth. Are we living in a part of the country where allergies are a particular problem, and is there anything that can help relieve that?
I don't know that there's any place in the whole world where one can get away from allergies completely. People react to different types of things. We're fortunate here in that our air is certainly much cleaner than in some of the areas in the industrial areas of the country. Yet, on the other hand, we have other things like Melaleuca and things like that, which people find to be a real irritant. So it's a problem everywhere, I think.
And many other things can cause eye irritation or burning. Such things as dryness of the eyes. As you mentioned, when we inevitably get older, we start to develop cataracts, gray hair. And one of the other things that happens is there's less moisture produced in the tears. And eyes must have a constant coating of moisture, or else they become dry, and that causes irritation and burning. In older people, that's more apt to be a cause of the discomfort than the allergy. I generally tend to think of my people with allergies as being the younger folks. In the older patients, I'm going to start looking for things such as dry eyes as a cause of their problem. One comforting thought is that none of these things need to be considered serious, though. It's not something that is apt to lead to any significant visual disability or permanent impairment. They're very easily treated and controlled.
Remember when I was young, before I got my first pair of distance glasses or something, and somebody told me that by getting glasses you became more dependent upon the correction and your eyes got weaker. Is there any truth in that? Is that a wives' tale? I mean, I think probably there's other folks besides me who put off getting glasses thinking that they would work with strengthening them as much as they could. Something. Is there a lazy eye or something that's induced by corrective devices?
To us, there are such things as lazy eyes, but no, lazy eyes are not induced by glasses. In early life, the lens in the person's eye can accommodate. That means it can focus in and out. But as we get older, the elasticity or the flexibility of the lenses decreases, and consequently it does not focus in and out and keep objects in clear focus. And that's the role of the eyeglasses. The eyeglasses help to make up for the difference in the focusing power that's lost through age. I try and remind my patients when they get their first pair of reading glasses or distance glasses that please don't worry about using these glasses. You may find over the years that your eyes do change and that you do require the use of the glasses more and more, but that's not because of what the glasses are doing. It's because of the way your eye is changing.
People have a misconception that you can wear your eyes out for some reason or other, or you can, when you're reading in dim light, you're going to harm yourself. It's not the case. But these are things which have been perpetuated for years and it seems to go on.
In recent years, as I've been tested, I note that I now get tested all the time for glaucoma. What is that and how serious a problem is that?
Glaucoma is a disease that's easily tested for and should be tested for on every examination of a person who's old enough to hold still. It used to be said that glaucoma is really a problem only in older people, but it can occur at any age. A person can even be born with glaucoma. Now, that's unusual, and certainly it occurs more frequently in people as we get older. But really, even children old enough to hold still should have their pressure tested. But that's not the only that's not the only part of the eye exam that determines whether or not a person has glaucoma. In addition, one has to look inside the eye to make sure the main nerve inside the eye is healthy. And if there's any suspicion then a more formal examination of the peripheral vision as well as the center vision in terms of certain types of testing called a visual field will be necessary to determine. The sneaky part about glaucoma is that there aren't any early symptoms about it to let you know that you need to have your eyes tested. So that has to be an integral part of every eye exam.
How do you treat it when it's found? What do you do with it?
Usually with drops. Occasionally that's insufficient and perhaps laser surgery or another type of surgery may be necessary, but usually drops is sufficient to control it.
Are there any particular causes for nearsightedness or farsightedness? Is that something that's hereditary or is that something that's caused by factors after we're in this world?
I believe really you can't say that it's going to be hereditary. Sort of in families they can have anything from a +5 to a -5 or high myopia and high hyperopia. In my own family basically we have that extreme. So you really can't say it's that way unless you have certain conditions or in a family which may have a microphthalmos or a small eye, maybe more hyperopic or farsighted. And if it's not caught early, then the person may develop amblyopia or that eye may never develop adequately, so the person has the true lazy eye which we think of. The other condition may be a high myopia, which in certain populations they have more myopia, like the Japanese. They have a higher percentage of myopia than we do in this country. And as an example, they have, for procedure for that, was radial keratotomy, developed initially in Japan. But then the person who did that therapy stopped it when contact lenses became available in the late 50s. So it becomes interesting to see how things happen. But certain nationalities, certain populations have certain predilections for conditions.
Used to see years ago, it seemed to me, a tremendous number of people with crossed eyes or with a misaligned eye, and it seems that you don't see that anymore. Do you not see it because there are ways of treating it now or things that are done for it? And what do you do in that kind of a situation?
We don't see it as often as we used to because it's detected earlier. There's been an intense effort to educate parents and pediatricians and general practitioners who have the chance to see children when they're very small to refer these children on to the ophthalmologist so that we can treat them. Sometimes these people respond to eyeglasses, sometimes they need to have eye surgery, sometimes they're treated with eye drops. But in general, if this type of problem is detected early, the vision can be saved and the eyes kept aligned.
Is there a do and don't list for preventive care, how you take care of your eyes? I remember my mother used to tell me, don't read in a dim light, you'll go blind or something. And then years later, I heard somebody say to me, well, that's not at all true. I mean, it doesn't affect your, but are there things that we should be doing to take care of our eyes?
Certainly. One of the things that pops in my mind immediately is prevention of injuries. When people are using power tools, for example, or if they're hitting a nail with a hammer, they should be using some kind of protective eyewear. There are many types of chemicals that people can be exposed to, and if they just have their glasses on, they get some measure of protection. Goodness, people sometimes pour acid in their swimming pool and it'll fly back and hit them in the eye, and they could have prevented that had they had their sunglasses on, for example. So there are many things that a person can do to help prevent injuries. Diseases, there aren't really a whole lot of things that you can do to prevent in terms of diseases other than just the general health measures that we talked about earlier.
Eating carrots going to help me?
Not unless you're vitamin A deficient.
Okay. We've about run out of time. I did want to mention, though, that for those at home who would like more information about eye care, you can contact the local chapter of the National Society to Prevent Blindness in Florida. And you can reach them by calling 1-800-226-6772. And there is also the National Center for Sight, and that number is 1-800-221-3004. And there are people at those phones during the week, normal business hours, that will be happy to help you with anything that hasn't been covered by the live program tonight and by our discussion here as well. Gentlemen, I want to thank you all for taking the time to be with us tonight, and thank you out there for being good enough to view with us.
This has been a production of WSFP-TV, Southwest Florida Public Broadcasting.